Hello friends, I am Dr. Amol Pawar, consultant physician and diabetologist attached to Kolekar Hospital. Today I am going to discuss with you a very important topic, that is common diabetic problems and complications. All of us must be having at least one relative or a family member who is suffering from diabetes, or we must have heard of diabetes and how big a problem it is. To put it in very short, diabetes is a problem of uncontrolled blood sugars, a fasting more than 110, a postprandial sugar more than 140, and an HbA1c more than 7 qualifies for the diagnosis of diabetes. You will be aghast to know that India is almost poised to be the diabetes capital of the world. That means the number of diabetic patients in our country is going to be the highest in the world. We are going to overtake China very soon. Now, what are the common complications which we see in diabetes patients? It is very important for us to know because we can identify them quickly and suggest treatment also, or take the patient to hospital. Let us first see the problem associated with increased blood sugar or high diabetes. The commonest symptoms that a patient with high blood sugar gets is polyphagia, polydipsia and polyuria. Polyphagia means increased hunger, polydipsia means increased thirst, and polyuria means increased urination. So many times a patient goes to a doctor because he has these symptoms and then is detected to be a diabetic on investigation. The other problem which we get to see in high diabetes is a serious complication known as diabetic ketoacidosis. It is a condition where sugars usually are more than 500. Patient becomes unconscious, and this can be precipitated by some infections or insulin deficiency, etc. And patient always is dehydrated and needs to be in the hospital in the ICU. And a similar condition where the sugars are high is known as hyperosmolar non-ketotic coma. So these conditions are associated almost exclusively when the sugar is more than 500, and one should immediately take the patient to the nearby specialist and admit in the hospital. Next, we see what are the problems associated with low sugar. Sugar should normally be more than 80 at any given time. When sugar goes below 80, then patient starts developing what we call as hypoglycemia. That is, the sugar in the body becomes so low that the brain and the nerves, which are actually dependent upon sugar, do not get their nutrition, and symptoms of neuroglycopenia come up. Commonly, patients start feeling giddy, they feel dizzy, they have a lot of sweating, they may start blabbering, they may feel hungry and want something to eat immediately. That is the time when we should suspect why this person is behaving abnormally. Sometimes beyond this stage, if the sugars fall to below 60 or below 50, we might find the patient unconscious, or we might find the patient in coma also. And very rarely and unfortunately, if the sugars fall beyond that, a person may die. So we have to identify this. It is imperative that all people have a glucometer in their house. So immediately within seconds, one can identify what is the level of the sugar. Treatment of hypoglycemia is very simple. Immediately give something sweet to the patient. What I suggest is 8 to 10 spoons of sugar dissolved in a glass of water, or Glucon-D powder, or some chocolate, and immediately rush the patient to the hospital, where an intravenous glucose drip can be given to restore the consciousness. Now, if we talk about other complications of diabetes, there is no organ which is spared by diabetes. If we start from head to toe, the first major organ which can be complicated by diabetes is the brain or the nervous system, where the brain is affected either in terms of stroke or in terms of certain infections of the brain. A diabetic patient is more prone to get infections of the brain, like meningitis, which could be tuberculous, viral or fungal. In the peripheral nervous system, patients usually complain of pins and needles and हाथ पैर में जलन होना, मूंगी आना, etc. These are symptoms of diabetic peripheral neuropathy. Coming below the brain, then you have eyes. What is the use of living if a person doesn't have vision? So diabetes affects the retina, that is the posterior chamber of the eye, आँख के पीछे का पर्दा. And if the patient's diabetes is uncontrolled, he can suddenly have retinopathy, because of which his vision gets lost and it will be a real big problem for the patient. So we always recommend that people who have diabetes, they should always keep their blood sugar under control and visit an eye doctor at least once a year. Going beyond the eyes, then we come to the chest, where the most important organ there is the heart. All diabetic patients are prone to develop cardiac problems like myocardial infarction or heart attack, as we commonly know. They are also prone to develop other complications like hypertension and dyslipidemia. Beyond that, when we enter the abdomen, the most important organ there are the kidneys. Diabetic patients, all of us must have seen that in the past 1 or 2 decades, many patients are developing kidney failure and going on to the extreme complication of being on dialysis. So if diabetes is not controlled, then it attacks these organs and causes what is known as a target organ damage. So diabetes complicating a kidney will lead to progressive renal failure, and patient will eventually need dialysis or a renal transplantation. So it doesn't happen in one day, but slowly, if diabetes is uncontrolled or it starts complicating, then patients can develop these problems. Then when we come to the peripheral vascular system, that is the blood vessels of the hands and legs, many a times you must have seen patients whose legs have been, affected with some kind of a diabetes wound, some kind of a septic focus. They may have developed gangrene, or in worst cases, many patients lose either a digit because of an amputation, or they lose a foot, or worst cases, they have amputations at the level of ankle or at the knee. So this is quite frustrating, and a loss of a limb will totally change the outlook of a person in his life. So diabetic foot and diabetic peripheral vascular disease are very important complications, and they should be avoided at any cost. Apart from this, diabetes patients are more prone to develop different kind of infections. In general, immunity is low. Patient get more of viral infections related to the chest, to the respiratory tract. They are more prone to develop the important and devastating disease like tuberculosis. And dermatological problems are also very common in diabetic patients. You must be seeing that they get a lot of fungal infections, funci, bal toad, or case toad as you call them in the local language. Plus they also develop eczema, cellulitis, so on and so forth. Then regarding the genitourinary system, one can get urinary tract infections, local perineal infections, and these can pose problems. So my today's talk was just to make all of you aware that diabetes is a disease which needs to be controlled, and needs to be controlled well. We need to follow good diet, exercise, and take the proper medications from the doctor, and continue visiting the doctor at regular intervals. A little bit of mistake from the patient side can make the patient prone to develop these infections or complications, and that can be very problematic for them. Thank you very much.